If you're experiencing frequent UTIs and are also forming kidney stones, you're going to want to check out this video. Not only are we going to walk through why your UTIs may be leading to kidney stones, but we'll also discuss 3 strategies you can use to minimize your risk for those kidney stones. Hi, I'm Joey Weichman, and welcome to Stone Relief. Bacterial-based kidney stones formed by urinary tract infections account for roughly 5% of the kidney stones worldwide. Even though they make up a small percentage of the overall kidney stone scene, they are nothing to screw around with. For most individuals, they're nothing more than a frequently occurring annoyance, but in some instances, things can turn pretty deadly pretty quickly if not managed appropriately. But what's leading to all these UTIs? And how does a UTI even begin to form a kidney stone? To better understand all these elements, let's begin with a little bit of background to set the table for the discussion we'll have later in this video about how these stones form and what you can do to protect yourself. So, the first place we're going to start with is just the definition of a UTI. And basically, again, this is a urinary tract infection. And this is a bacterial infection that is occurring somewhere in your urinary tract. And this could be anywhere from your kidneys to the ureter, down to your bladder, and then also in the urethra as well. So this can really spread all across that urinary tract. Now, prevalence rates much higher with women. So about 40% of women over the course of their lifetime are going to experience a UTI at some point. And with men, it's only about 12% of the population. So, mostly speaking to women in this video. Now, when it comes to UTIs, these can cause kidney stones, and in particular, it's going to be the calcium phosphate and the struvite variety of stones. And this is because of the alkaline urine that this bacteria that is causing these stones creates, which then feeds itself and starts to form these type of kidney stones. And struvite is actually a part of the calcium phosphate family of kidney stones. Now, on the inverse side of this, and that's why I've kind of got these arrows, because it's basically just this big cycle, kidney stones can also cause UTIs, and this is mostly driven by stagnant urine, and stagnant urine tends to be a breeding ground for all different kinds of bacteria. Now, this is not only true in our bodies, but this is also true in nature as well. So if you think about stagnant or standing water anywhere in nature or in your home, this is typically, again, bacterial breeding ground, but this could also be like mosquitoes and other types of nasty things that occur. So anytime you've got this stagnant type of urine, which a stone will create in most instances, you have the opportunity for bacteria type of form. And when bacteria forms, it creates this alkaline urine type of environment that, again, this just feeds this really nasty type of cycle here. So in the next couple chapters here, we're not only going to talk about what actually the process by which a kidney stone forms, but we'll also talk about some of the things that you can do to try to prevent UTIs from occurring, which will eventually lead to prevention of kidney stones. We'll see you in the next chapter. Okay, now that we know what UTIs are, let's talk about how they actually go to work and start to form kidney stones. So when we have bacteria present in our urinary tract, they actually produce an enzyme called urease. And I apologize if I butchered this. Someone in the medical community maybe correct me, but this is the way pronunciation I'm going with. So urease is an enzyme that is produced. Now, inside of this, urease splits urea, which is a protein byproduct that is found in our urine. And when this occurs, it creates ammonia, and it also creates carbon dioxide. Now, when those elements react with water that's found in your urine, they're going to create even more of a breakdown of this. So this is going to go from ammonia and carbon dioxide down to 2 ammonium and 1 bicarbonate ion for each molecule of urea. And there are lots of this in your urine. Now, what happens from this is problematic. And we talked about this a little bit more over in this first chapter about this vicious cycle that occurred here during the bacterial stage of alkalization of our urine. And that's really what's happening here. So ammonia and bicarbonate are both alkalizers of your urine. So when this occurs, it creates a very alkaline urine environment, 8.5 to 9 on a pH scale. Now remember, 7 is neutral, and kind of plus or minus a half a point on the pH scale is generally tolerated as within neutral bounds. And again, with calcium phosphate stones, it favors an alkaline urine environment because calcium favors phosphate instead of oxalate when in the presence of alkaline urine. So this is a bad thing. And again, this cycles back to this whole vicious cycle that we were talking about. So when we've got these things that are alkalizing the urine, problems start to begin. So with alkaline urine, this actually degrades the protective layer inside of your urinary tract that is meant to shield you against bacteria. And this is why we're having these problems start to form. So when this occurs, that damage leads to bacterial biofilms starting to form, which then act as the foundation of both calcium phosphate and struvite crystal formation, which is the first stage in starting to form these different types of kidney stones. In the next chapter, we're going to talk about 3 different strategies that you can use to try to minimize your risk for UTIs and kidney stones.
Just a reminder, this information is available in written form on our website. Find the link below in the description.
Okay, now on to our last chapter, and probably one of the most important. What can you actually do to try to minimize your recurrent UTIs and also reduce your risk for kidney stones? Pretty simple stuff here, but it's not always something that's top of mind. So the first thing that's really going to be probably one of the most impactful things is practicing proper hygiene. Now, bacteria is everywhere in our environment. It is all over our homes, it's all over our skins, like all of our skin. There is a literal microbiome all throughout our body full of different types of bacteria. Not all of them bad, per se, but it's everywhere. So if you're going to be interacting with your genitals in particular, or any other part of your body or orifice, try to just make sure that your hands are clean. Now, I just want to make a mention of this here. I am not a proponent of using antibacterial or hand sanitizer types of soaps or anything like that, because that kills the microbiome on your hand. But just a nice light surfactant-based soap, maybe a towel-based soap that will just clear off offending bacteria from the surface of your skin, but not kill the microbiome that has developed over the course of many years through your skin and throughout your body. That is a very protective element that we have in our body. But you have to just make sure that you're being conscientious of these things, especially when you're a woman, because when it comes to your urinary tract, the distance between your outside world and your bladder, which is really kind of the entrance to the whole rest of your urinary tract working its way up to the kidney, it's a lot shorter than it is for men. So you have more exposure to potential bacteria than men do. This is why 40% of you will experience a UTI over the course of your lifetime versus 12% of men. Now, the next thing, if you have a kidney stone and you're actively passing one, avoid stents unless they are absolutely necessary. I'm not quite certain why stenting has become so popular in the most recent future or the recent past, but it seems to be on the rise. And they're really not appropriate unless there's a very specific situation that is occurring that you need immediate release of urine in order to, minimize your pain while you're waiting for surgery, or in an emergent situation where there's a really severe situation of hydronephrosis and it's causing damage to your kidney and you got to relieve that pressure. Outside of those situations, generally a stent is not recommended, because not only is it a breeding ground for bacteria, but it will also stop the passage of your stone or stone particles if you've had a procedure to break up a kidney stone. So in general, these are just best to be avoided, but for whatever reason, a lot of urologists and a lot of doctors are starting to place these in patients who've had either a kidney stone procedure or are waiting for a procedure. So just avoid this. And if you're looking for more research or more information on this, we actually have a really handy guide that we'll link in the description below that you can get access to. It's the the stent survival guide, which will tell you everything you need to know about when a stent is appropriate and when it is not. Now, lastly, boosting your immunity. Now, the best way that I can describe this is by using an analogy that one of our content writers, Marie's, came up with. And it's really akin to a home security system. So a home with steel bars over the window, deadbolts on the door, and all sorts of different countermeasures to prevent burglars from getting into the house is probably going to keep burglars from getting in the house. They're really going to struggle if they try to break in. And that is the same thing that has to do with our immunity with our body. So if you're eating a species-appropriate diet that is predominantly animal-based, if you're forming kidney stones, so that means meat, dairy, cheeses, and seasonal fruit when appropriate, depending upon the latitude by which you live, this is really your best defense, because proper nutrition equals strong immunity, and strong immunity equals a strong defense system. So you will be more able to prevent any kind of bacterial infection or bacteria that you may encounter in your environment, which will minimize your risk of the UTIs forming, which will also then, again, go to that vicious cycle that we talked about earlier, minimize your risk for kidney stones. If you're looking to get more information like this, click the link in the description below and get instant access to our online community for kidney stone sufferers.
Visit our website if you'd like to join a community of people learning to manage their kidney stones naturally. See you in the next video.